receive vaccine in what's called week 1, and that was for their frontline healthcare workers. They received enough vaccine to cover all of their healthcare workers. However, the uptake and interest among their healthcare workers was about 65%. And while we would like to have it be higher than 65% for at least the initial interest for doses, the good news for that is that meant that there was additional available for the hospital to be able to then expand to also vaccinate their healthcare providers. And they also assisted us in moving into 1B by providing vaccine for assisted living staff who were interested in being vaccinated. I will say, though, that the assisted livings, which are in Group 1B, my staff made sure that every assisted living facility in Frederick County had signed up for that federal pharmacy partnership program where CVS and Walgreens come into the facility and vaccinate all staff and residents. There were a couple assisted livings that the CVS and Walgreens had already vaccinated when they were in the process of vaccinating the nursing home that's also associated with those assisted living facilities. But I would like to say that every assisted living facility in Frederick County has signed up for that federal partnership program, and that the state has activated that agreement with CVS and Walgreens, and we are now waiting for the facilities to be contacted by CVS and Walgreens to actually schedule their appointments. What is also on that list for CVS and Walgreens are other congregate settings. So think of the Developmental Disabilities Administration group homes, and think of the mental health group homes, out of the Behavioral Health Administration, the mental health group homes. They are also on that. So think of Waste Station, Community Living Inc., United, or UCC, and MedSource are also on that list. What's not on that list for CVS and Walgreens, though, are the substance abuse treatment related or the substance abuse related group homes. So halfway houses, sober living homes, and residential treatment programs. So we have them on our list for the health department to be able to respond to their folks' needs. So also in Group 1B, though, as the governor announced and as everybody eagerly was awaiting, are the adults 75 and older. We also understand that education is in that group, as well as continuity of government. And I have to say it's been terrific working with Dr. Albin throughout all of this. We have frequent communication throughout the week and have been discussing for the education group how we might want to roll into that. And I am waiting for additional details on the continuity of government. And so a couple significant things from what the governor announced yesterday was, one, that 1B officially was starting for everybody across the state this upcoming Monday. Well, since we still had 300 appointments that were not yet taken from the 1A group for today's clinics, we made those available to individuals in the 1B category, and specifically the 75 and older. And those individuals self-scheduled or had other people schedule them last night. So again, in 25 minutes, all 300 of those appointments were taken up for today. And we have, at last check, 100 on the wait list. And we do have, from yesterday, we had some no-shows. So we do have a few extra doses that we had left over an allocation because we had some no-shows. But I do want to say, and I will repeat it again later, that by the end of our clinic on Saturday, we won't have any doses remaining. And now there'll be some no-shows, I suppose, so we'd have a few doses, but we won't have doses available to have a clinic Tuesday morning. And we don't know at this point when we'll receive our delivery. So we are also not opening up appointments for Tuesday afternoon yet. I do have my staff on standby. It also presents a challenge staffing wise because people need to have their number of hours a week of actual work. But we do have the staff on standby for a clinic Tuesday afternoon if we end up getting vaccine Tuesday morning, and we'll have time to get it to room temperature, which takes a couple hours with the Moderna product. But I will repeat that again. I'm sure you all have questions, but I just wanted to reassure everybody that all the vaccine that we have in our storage is committed to appointments that are already scheduled through to Saturday, this Saturday. And then we will have none, although there will be some missed appointments, some no-shows. So we will have a few doses, but not enough to schedule an appointment. And then the 1C category, that was also what was significant that the governor said, because it's, a month ahead of schedule, more than a month ahead of schedule. Because before that was, the anticipation was, at the end of February, we'd be really getting into 1C. And so he said, the 25th of January, 1C, let's get that started. Before I go on, does anybody have any questions before we move on to the next slide about who's in which category? Again, these are the governors. I'm doing my best to try to understand it, and also doing my best to try to be consistent across the state with the understanding and the interpretation of who is in which group, and also recognizing the fairness and trying to hold the line. So unfortunately, my staff have had to turn people away when they have come in, presented themselves to the clinic and weren't able to provide any information that gave us confidence that they actually were in the 1A category. So we have had to turn people away. But, I think that's what we need to do in this situation where there's limited vaccine and a lot of people who are in the eligible categories, that we need to make sure that with this limited vaccine, that it's open only to the individuals who are in the current phase as the governor has identified them. So any questions?
Yes.
Yeah.
Yes, Madam Chair.
Yes, I recognized Delegate Krim.
Oh, thank you. Thank you, Madam Chair. So Dr. Brookmeyer, I just want to summarize here so I understand completely. So where does somebody go to make an appointment, please?
Oh, well, I have that coming up in future slides.
Okay. All right. Fine. Fine. All right. And then in the categories, you said that 1C would start January 25th, correct?
Yes, I believe that's what the governor said. I don't have his
Okay.
press release in front of me, but it's 2 Mondays from now, not this Monday, but the Monday after that.
Right.
Just to be clear,
Okay.
they will be eligible, but we may not have vaccine for them.
I
want
know.
that clear.
I know. So what I want to know is for 1C, are you taking advanced appointments or do you just do it on a daily basis?
So I'll answer that now, but it might be flow better if I address
Okay.
that when we get to the appointment scheduling part of.
Okay, that's fine, doctor. I just want to be sure that we get that answered. Thank
Right.
you.
Maybe you should do the whole
Yeah.
presentation
Okay.
before you take questions.
That's
Okay.
a good idea. And let me just suggest to the delegation that if you want to speak or ask a question, there are 3 ways you could do it. You could just put your hand up. The other is put a comment in chat, or go into reactions. And there's a way you can signify that you have a question in reactions. Obviously, we don't want to all speak at once, and I want to try to call on you in the order that you had a question. So thank you.
Okay, next slide, please, Joy. Okay, so again, this was prepared prior to the governor's presentation, and we had been preparing for moving into Group 1B formally. And at this time, we have 2 vaccination clinic sites that we're operating under. And given the amount of vaccine that we've had, the 2 sites can get us through the vaccine each week. And looking at the efficiencies, we've opened just the 2 clinic sites and not the others, although we are prepared to do so. And want to thank Dr. Albin for making school sites available to us. All of you may or may not know that over the years, our pandemic influenza planning has relied heavily, as well as also the planning for an anthrax scenario where we needed to have distribution sites for medication, where we need within 48 hours to get medication into every person's, well, make it available to every person within 48 hours. The schools are central locations for that. And I appreciate that the school system leadership has made the schools available, even though we realize that there is also the hope that we can get students into the schools safely as soon as possible. We do have other sites, including a drive-through, that we're working on for those individuals who prefer something like a drive-through. And the appointments, as the governor had emphasized, are by appointment only. And that's for a couple reasons. The main is that we're trying to prevent people from being in a situation where they're crowded. And appointments allow us to space people out physical distance-wise. It also makes it so that we're not experiencing a first come, first serve. So only the people who are hardy enough to be able to stand in line outside overnight in the winter can get vaccines. We have plenty of experience from the H1N1 vaccination experience, which I'll spare you from all the details, but it is based on these prior experiences that we're drawing from, as well as the more recent experiences from other jurisdictions and what they've experienced throughout the country. But I would say the governor had, I believe, was clear in saying that all the appointments will be, excuse me, the vaccines will be scheduled by appointment only. And I'll, in future slides, talk about what we can do to reduce the barriers, because certainly we want to eliminate barriers that would present. The final bullet on this slide is that we've received 5,000, the health department has received 5,800 doses, which is not a lot. As county executive said in her briefing yesterday, 100 of that is for second doses. And all appointments through Saturday are full, and those appointments match the number of remaining first dose vaccines that we have. Next slide, please. So to repeat, because I know this is an area of much interest, the long-term care facilities, so that's nursing homes, and then also assisted living facilities. So all 9 of the nursing homes in Frederick County have received their first dose. That was done by CVS Walgreens, about 1,000 licensed bed, about 1,950 staff. They are also scheduled for their second doses. And then for people who got a first dose on the second dose appointment, there is a third time when CVS and Walgreens will be visiting those nursing homes to provide the second dose to persons who missed the first dose, the first visit, and instead got it on the second. And assisted living facilities, they will be scheduled as well by CVS and Walgreens. Again, the hospital with some of the doses that they had remaining because the staff uptake was not 100%, but yet they received an allocation of 100% to match their staff. They volunteered to do the adults, the staff members in the assisted living facilities, as well as to vaccinate their primary care providers and home health and some others affiliated with the hospital, including the Frederick Integrated Health Network. Next slide, please. So again, this is the presentation from pre-governor's presentation last night. The process for people to schedule an appointment is based on going online. So the first one, the people in 1A, they had access to the internet. It was an employment-based opportunity, and then the nursing homes, who it wasn't employment-based for the residents, they were already being taken care of by CVS and Walgreens. So the online system and online registration is what we had for 1A. We fully realized that for the 1B group, that's not adequate, that's going to present some barriers and challenges for individuals who might not have family members or friends who are able or willing to sign them up. So we are also planning for phones, so people can schedule via the phone. Next slide, please. A lot of people want to know, well, how can I find out when there are updates? And we activated this text update information line a while back. So people who are okay with getting text messages, that's one way that they can do that. We have had people who follow us on Facebook, our website, the County Executive's Weekly Briefings are another way to do that. But we do want to emphasize that this texting, getting the text updates is not the same as scheduling an appointment. So that's text Fred COVID-19 to 888-777. Next slide, please. And looking at how to make a vaccine appointment. Again, this presentation was pre-governor's announcement, but so when you're eligible to receive your vaccination, we will send out announcements as to which group we're serving, but I'd say, you know, last night the governor said who we're serving, and so everybody is expecting that they'll be served. For those that don't have internet access, we will be standing up a phone bank in order to assist people with making their appointments. After people have had their first appointment and they've been vaccinated, in the post-vaccination waiting area, they will receive information about how to schedule their second appointment and can do it right at that time. We have both a QR code that people whose smartphones can snap it, they can do that. For people who have, they can also type in the URL, and for individuals who don't have that, we will have people there who can assist them with making their appointment if they want to choose that option instead of the QR code or typing in the URL. Next slide, please, because I want to see if I forget if we have registration. Okay, could you go back one, please, Joy? So the other question, now that it's opened up to all those groups, and we've tried to listen carefully, I've listened to the governor's presentation twice now to try to understand and reconcile what I heard him say. It's open to everyone in 1B starting on Monday, and then the next Monday it's open to everyone in 1C, but I also heard him say we should be focusing on the persons who are older and persons who are vulnerable. So it's a little difficult doing that, and especially if the process is to, you know, when the process to schedule appointments is either by the internet or by the phone, which does, again, help to make it a little more fair because not everybody can stand in line outside overnight waiting for a first come, first serve at a physical location. But it does still present a challenge, and I've got the experience from H1N1 where still with a phone number or an online registration that it's still potentially subject to a first come, first serve when we're in a situation where we don't have enough vaccine for at the current week for everyone who wants to be vaccinated in the current week. So we will also be setting up a pre-registration system. So the state software that they made available for hospitals and for health departments and are requiring that health departments use, this scheduling software it was expected to have a functionality where it would allow people to pre-register. It's pre-register, not schedule an appointment, but to pre-register so they can put their information in and they can let people know, I have this characteristic. I'm sure you're receiving those same communications. Someone says, I'm 65, I'm 75, I have this. Well, the pre-registration system was to have that. The pre-registration system, I don't have information on when it will go live or what status it's in right now, but it's not, as from the last information I have from yesterday, the pre-registration system in this PrepMod software is not going to be available this Monday. it's not going to be available next Monday. So our terrific IT department is standing up a pre-registration system for us here at the health department. And based on our experience with H1N1, where we had, when we first set up a phone line, in the first 3 minutes, we had over 1,200 calls to that one number within the first 3 minutes, which overloaded the circuits of the company. We actually we had the foresight to use one of those companies that it's one of those 1-800, like ShamWow, everybody call across the country at the same time. And they weren't able to handle it, even though they had 300 operators ready at the time that the phone system went live. So in order to avoid that kind of a situation and to make it more fair, where it's not just first come, first serve, or that it's not first come, first serve, we're going to proceed with pre-registration system. We ended up doing that for H1N1 after that experience with that phone service. And it worked well right after that. So our IT folks had made a registration system for us. And then each day, as more vaccine became available, because it was the same thing back with H1N1, we didn't know when we were going to get vaccine, and we did not know how much. Now I know how much on Saturdays I'm going to get. I'm just not sure exactly which day it's going to arrive, but at least I do know the amount on Saturdays now. So with H1N1, we didn't know the amount and we didn't know when it was going to arrive. So what we would do for that is through this pre-registration system that we had for that, we would extract the names. We had a random generator process where we could then extract the names, and then we could contact the individuals. And back then it was just all via phone. Then we would call those individuals and we would actually schedule them for their appointments. Now what we will be able to do is we will be able to reach people both via email, cell phone, text, potentially, but via email, and then also via the phone to schedule their appointments for those who've pre-registered. So our interest is to drive everybody into the pre-registration, so that will allow us to then make it a little more fair, so that people who, and I was sharing earlier with my staff, there's something that I need to get my kids scheduled for every year. 8 o'clock at night is when the system goes live. And one year it was like 10 minutes after 10. And, I had been working and I couldn't get onto the system till then. Well, all 1,000 slots were already filled by then, and my experience is hardly a challenging one compared to what all of our constituents have to face. But I know that frustration and thinking that is not fair. So we want to take an approach like we did with H1N1, where we try to come up with a system that's fair and equitable, and it isn't based on whoever can dial the fastest or whoever has the luxury of going to the website every 5 minutes. And we will, our telephone system will also register people. So we will have people who can register people via the telephone, and then also people via the telephone who can schedule appointments. Next slide, please. And then we have gotten some questions about the vaccine cost, because again, we want there to be no barriers and no misunderstandings about what barriers might be there. So the vaccine cost for the health department's operations, we're not charging at all for anything. Now, y'all might have heard something similar with the testing. So while insurance companies to cover the testing, especially for people who are symptomatic, there are some providers out there that they're charging for an office visit. So while the feds require that you don't charge for testing, for the lab processing of the testing, people are charging for an office visit. So individuals who don't have insurance are paying out of pocket for that, and people who do have insurance, their insurance is paying, and we're all paying for that in our higher premiums to cover things. So that's why I felt it was important to make sure that everybody understands that no one is to charge for the vaccine cost, but those other charges that people might get, an administration fee and also a clinic visit fee. For the health department, we're not charging for that. Now, I realize we could, it would be a source of revenue, But again, in this pandemic, at this stage in the pandemic, we need as many people to be vaccinated as possible and as quickly as possible. So we're not going through those extra steps. But when people go to their primary care providers will be billing their insurance. The federally qualified community health centers, which we have one, the Frederick Community Action Agency, we're fortunate that we have a federally qualified community health center. They will be receiving vaccine and will be able to vaccinate their clients as well. They, if they do end up charging an administration fee, theirs would be much less than others because their sliding fee scale is based on ability to pay. But we all have the Frederick Community Action Agency and the Health Department. We have the interest in having as low a barriers as possible. Okay, oh, and then so the other part is the information about vaccination options, because I know there's a lot of questions. Well, how do people know where to go? And people tend to go to their usual sources of information. So people who normally come to you are coming to you. And people who normally go to social media are going there. And people who have individuals in their community, organizations that they belong to that they feel comfortable with, or their church, or the business community. So we, now that we're moving to the next vaccination groups beyond the 1As, which we were able to very easily reach out to first responders and to some extent the healthcare workers. Now that we move into this other group, though, the community-based organizations and faith-based organizations will be important partners for us in getting information out, and also encouraging them to think about what they can do to help their members or their congregants to register. Because people can register for someone else. When I say register, you're right. The pre-registration, someone can pre-register someone else. So a family member can, a friend, someone in the church can do that. And when it is also time for scheduling, someone can do that. But the scheduling does involve the consent form. So the individual does need to be able to give consent. And it also does ask about personal health conditions. Have you had a severe reaction to a vaccine before? Some other things like that. So we do need the individual to be present for that. But the process, again, are attempting to have a system that is also low barrier. Next slide, please. Right, people have, I got another email yesterday from somebody who said, we haven't left the house since March, and we don't want to go to a place where there are going to be other people. We will be standing up a drive-through. That will probably be responsive to many people's concerns about that. And we'll have the hours for the drive-through to be such that individuals who work during the day but want to get their older family members or themselves vaccinated will be able to do that. That clinic will be open later than some of our clinics where they're walking clinics. Next slide, please. This may be a question that you get a little bit less, but I wouldn't be surprised if you get every question, because people expect that you know all the health answers too. So people who have already had COVID, they want to know, can I get the vaccine? Should I get the vaccine? So the answer is yes to both of them. You can, and yes, you should. We do want to make sure, though, that people have completed their isolation period. So that's the period when it's thought that they are most likely to be infectious. So we want to make sure that before they come out and about and come to a clinic location that they're no longer infectious. The other part, though, which gets a little more tricky, is that we have limited vaccine available. There is also evidence that people who have recovered from COVID-19 for some time period probably have some immune system protection. It varies by person. Individuals have individual responses. So can't say for sure for every single person who has had COVID that they will have protective antibodies for a week, for a month, for 3 months. When we look at the large population studies, the CDC's analysis is that within 90 days from someone's initial infection, they are unlikely to be reinfected. So if they're unlikely to be reinfected, and assuming they're having the same types of interactions that they did before, biologically, it's likely that it's because they have some level of immune system protection. That might be antibodies, but there are other parts of the immune system which are likely also contributing, but yet we don't have a good way to measure or assess those contributions at this point and the effectiveness of those other parts of our immune system in providing protection against the SARS-CoV-2 virus. Having said that, if someone has, within the last 90 days, tested positive for COVID, they've recovered from their illness or out of their isolation period, depending upon their work and their work exposures, I would recommend that they consider getting vaccinated now. Some people are in very high risk situations where they're working. And we don't know if people's natural immunity, how long that lasts. But we also have limited supplies of vaccine. So for individuals who are able and willing to delay being vaccinated because they've recently had a COVID infection, that's also okay. But it's individual choice and decision-making for that individual. Like everything with COVID, for each person's circumstance is unique and has nuances that are important to consider. And the data that we have is for general populations. Individuals' experiences can vary. In order to respect the individual variation, it is permissible for people to be vaccinated, but also if they'd like to wait, that is also okay. Next slide, please. So the two types of vaccine that are currently authorized by the FDA for use, the Moderna vaccine, which is what the health department has received, and the Pfizer vaccine, which is what the hospitals had received. So I do want to point out the ages when we talk about schools and the concern about schools. The products that are currently authorized for use, young persons are not eligible for vaccination. And that's because the research studies just didn't include enough persons in that age group for the effectiveness and for the safety to be evaluated in those age groups. I do understand that those companies are enrolling young persons now, but it'll still be some time. So when you're thinking about what percent of the population do we need to get vaccinated, or what number do we need to get vaccinated in order to get somewhere close to what you may have heard is the herd immunity, right now, children are not eligible for the current vaccines. There are other vaccines that are in the pipeline that will go a little bit younger, and eventually I would expect that the other vaccines will have enrolled enough young persons to be able to have their effectiveness and safety evaluated. But at this point, they're not. The next slide, please. We have had people volunteer through the Medical Reserve Corps. So if you get questions from people saying, I want to help, how can I help? So the Maryland Department of Health has the Maryland Responds Medical Reserve Corps, but people who don't have a medical degree are also eligible to sign up for that. And at this point, our clinics are being staffed by the folks from our school health staff, as well as other health department staff to run those clinics. And next slide. That is it for these slides.
Well, thank you very much. I know we have a couple of questions. I'm going to try to go in order that I saw hands. I do have one question first, and that is, how can we as a delegation assist you or support you in getting shots in people's arms and answering your questions from the state level?
Okay, I have a slide on that, Karen. after Dr. Brookmeyer. So
Okay,
maybe you can let me make a few comments before the questions.
okay.
All right, so I do want to say a couple of things, and I'll be very quick, related to the vaccination plan. From my perspective, this is job one. It's our top priority. It is how we win the war against the virus. And so while we are following a state plan and all the state requirements, and it's executed through the public health department, Frederick County government is trying to support that by providing administrative support, logistics, and money. I will tell you that so far we have received no state or federal dollars to execute this vaccination plan. So the county government is stepping up for that. We do have 7 locations identified for the distribution of vaccines. We've actually put together a logistical plan that says we want to vaccinate about 200,000 people twice, 400,000 doses, do that by the end of May. And we back that into how many locations we'd need, how many staff we'd need, and how many vaccinations a day we would need. Now that assumes we can get that vaccination. The vaccine itself. So the real problem is that we do not have vaccine. So the first thing that a variety of county executives have already asked the governor, which are things we will also ask of you, is shown on this slide. We want local flexibility to move through the tiers. The governor actually granted that yesterday at his press briefing. We would like to have published shared performance measures included on the state dashboard, including total residents that are vaccinated. Right now, we're lumped together in regions. So that's data. This is a big point, compensation for local health department personnel. Right now, the health department, after suffering over 40% of their budget cuts back in 2009 and 10, when there was a recession, which have never been recovered, we have asked the local health departments, a state agency, to do testing, to do contact tracing, and now to do these vaccinations. And people are getting paid comp time, but not overtime. And we really feel that overtime for local health departments would be important because they will never be able to use the comp time, which will expire after 12 months. And we're already in this 10 months. So all of the time that these folks are working day, night, weekend, well, basically they're not getting paid for it. And compensation should be considered for training others, whether it's volunteers, the National Guard, or others, to understand the local logistics of these distribution centers. We would like to have planned funding allocations. We do know that Congress, when they passed their last stimulus package in December, which the president signed after Christmas, that there was money that would come to states for vaccination planning. We would like to understand how that's going to come out to the health departments or to the county governments. We do not know that yet. But most important, we need to have a regular supply delivery cadence. So while for the last 2 weeks, Dr. Brookmeyer has been notified on Saturday of how many doses the health department will receive the following week. We don't know what day that will be received on, whether it received on Monday, Tuesday, or Wednesday. Therefore, scheduling appointments without knowing when you're going to get the vaccine is a huge problem. I will say a couple counties have tried to schedule in advance to keep it going, and they've had to cancel those appointments, which adds another whole layer of frustration and confusion to people. So again, Dr. Brookmeyer has told you that the health department has received 5,800 doses. That is the last 3 weeks, I would say, average 2,000 doses a week. Some of those are now going to second doses. And so we are going to be having a large number of people who are now eligible for something, want to sign up for it, want to get through the system, and can't do that because we just simply don't have vaccines. So I do want you to know we have 7 locations identified. We have the logistics tested, and we're ready to stand them up. But we have 2 stood up so far that are functioning right now, one of which the public knows about. We're not actually announcing those locations in advance because we do have people showing up to them to try to get a vaccine, and it has created a certain amount of disruption. So the county is going to support the call-in to help people sign up, and we're going to support the staffing, which right now is public health, school health, and then fire service, and then certain volunteers that are coming through that statewide system, and maybe some others. So those are the things that I am asking from the delegation. to really support our local health department is overtime, funding, and most important, a regular supply delivery cadence. It is very hard for us to get this scheduled out there and get it in people's arms when we do not know when we are receiving it. And we really don't have much lead time on knowing how much we're going to get. So if Barbara finds out Saturday she's going to get 1,900 doses for next week, and puts out a link for people to sign up to that, as she did yesterday, not very many people are going to be able to sign up. And the more of those doses that have to be used for second doses, and they are allocated for second doses, the harder it's going to be for us to make progress into the new groups of people. So the other thing I heard yesterday was that the school systems are all supposed to submit plans, and I don't understand. That was the first time I heard that. And so I don't know what that means for this group 1B. So with that, I'll let you ask Brookmeyer questions, and certainly you can ask any questions you have of me as well.
Thank you, County Executive Gardner. I do have a request for you. Would you send that slide to every member of the delegation, as well as maybe a 1 or 2 sentence explanation? I will commit to sending that to all of my contacts, and I hope that my colleagues will join me in really trying to impress upon the importance of some of these measures to have a smoother delivery of vaccines. I know, and I want to thank you both, Dr. Brookmeyer, you did a wonderful job of incorporating many of the questions that were forwarded to you. I do know we have some members of the delegation with questions. I saw Senator Young's hand up. Would you like to ask your question?
Certainly. Can you hear me?
Yes.
I actually have 3, so I'll do them. There's hopefully simple answers, and I'll do them all at once. And the hospital indicated they didn't use all of their doses. Have they forwarded them to you or elsewhere, and are they part of what's already been committed? And do you know how soon pre-registration can start? And then finally, will you finish scheduling 1A and 1B before you start 1C? If 1B is only going to have a week, they're probably going to get pushed back. And so is there any priority in getting them scheduled? Or is it going to be first come, first serve continually? That's it.
Thank you. Yes. First, for the doses that Frederick Health Hospital has received, after they had doses remaining from their staff vaccination, they asked us at the health department how we might collaboratively plan and coordinate for continuing to finish the 1A category. And so they first used some of those doses, additional doses, but they use those doses for healthcare providers who are in their larger network. So the Frederick Integrated Health Network with the A folks. And then when they still have to ask, seeing that we schedule.
You're breaking up a bit, Dr. Brookmeyer.
Oh, sorry. I'm going to stop my video and maybe that will help. Hopefully, is this a little bit better?
Yes,
because
it is.
I see all of you frozen. I'm in the office, so I can't do much about my connection here.
Recommends that even those vaccinated quarantine.
Yeah, so the hospital anyway, so when they had finished vaccinating their frontline healthcare workers, had vaccine remaining, they asked us what would be helpful for us in getting the community vaccinated. At the time, we were still heavily into the 1A group, and they offered to vaccinate healthcare providers who are affiliated with them. That was great. And then they asked, well, we think, we still have some more. Is there somebody else? And so at that point, then we were saying, well, I think, with this upcoming week, we were going to satisfy the big rush for the 1A group. There still might be others in 1A who haven't gotten in, but we will have been able to have the greatest demand met. So we offered then for them to consider some in the 1B category, and that was the staff for the assisted living facilities. And so they made use of their remaining vaccine to address that group. And now that we're looking at the 75 plus group, we've also been in communication with them about how they might be able to utilize any remaining vaccine, again, to respond to the community vaccination interests. So at this point, with their assistance with the vaccination, it hasn't been necessary for them to transfer their vaccine to us because they are continuing to volunteer to provide vaccinations themselves, which is great because they are vaccination extenders. I'm loving that. And but if it gets to a point where for them or for other providers, if they get more vaccine than what they're able to use, then the State Secretary of Health has sent out directives and orders that are directing them to make any uncommitted vaccine available to the local health department. I should say there is one detail to all of this, which so far it hasn't been an issue, but at the end of each night, when our clinic ends, we've got a vial. So the way these vaccines come is it's a multi-dose vial, 10 doses for the Moderna, it's 10 doses per vial. So just using hypothetical numbers, say we finish with our last scheduled appointment and there are 9 doses left in the vial. Well, once this has been at room temperature, we have a limited number of hours to use it. We can't put it back in refrigeration and save it for the next day. So we have each night, we've been contacting the Emergency Communications Center to send something out to all the fire and rescue and law enforcement who are on duty to see is there anybody else who wants to be vaccinated, and or persons who are assisting with the vaccination clinic. And so far, we've been able to utilize 100% of what's remaining in those vials. As time goes on and as more people who are assisting with the vaccination clinics have been vaccinated, that might be a little more challenging. We do have people on the wait list. And so with the wait list, we call them. But the other thing is this is at the night at the end of the clinic. So even if we can say, well, we have 3 more people who have scheduled appointments, we think they might check in, we're not sure. So about, so before the clinic ends, we can start calling people on the wait list, but we need them to show up, not show up an hour later. Those of you who work in the school system, you know what that's like. The parents are called to pick up their child and, an hour later they show up. So one of the things is how can we get people who are able to really show up soon? And that's why it's been helpful with the first responders, and also the fact that they've been in the 1A group. I think nationwide, there have been some news reports where it's possible that the scenario, I don't know for sure, but where they said, oh, somebody got a vaccine and they're not in the eligible group. It might have been because it was at the end of the clinic night and they needed to utilize that. But so far that hasn't been an issue for us because we found people who are in the eligible categories to be able to utilize that vaccine. But it will be a challenge for the healthcare provider offices because they will need to make sure that their appointments that they schedule for vaccine will exactly match the amount that's in the vials so that there isn't any, in that case, it would be wasted because once it's at room temperature, it can only be out for a certain number of hours. And, so the other questions. Pre-registration, when will that be ready? We'll be providing updates over the weekend. I don't have the definite date. It would be premature for me to give an exact time and date at this point. And then the question about scheduling 1C if we haven't gone all the way through 1B. And I think that's an area where I expect I'll have more communication with the Maryland Department of Health Secretary and Assistant Secretary and through the governor's office, because it also requires, if we're going to do something that is different from the intention and different from the expectation, we need to make sure that he continues to message the expectation is that those at the highest risk The most vulnerable populations, highest risk populations receive priority. Then through our pre-registration system.
You broke up on us again. Last thing we heard was through the pre-registration system. Dr. Brookmeyer, are you there? Okay.
Dr. Brookmeyer, maybe you'll have to sign off and sign back on.
I'm back in again.
Are there any questions that I can answer?
Yeah, we've got at least 2, maybe 3 more people that had their hands up. I know Delegate Pippi had a question. Perhaps you can answer it, County Executive Gardner. If not, we will try to get you an answer from Dr. Brookmeyer later.
Great. Just very, very briefly. So we've received, it sounded like 5,000, and I'm in the very beginning from when the vaccination rollout started in Frederick County, but I just want to confirm. So 5,800 doses to the health department, additional for second doses. And then nursing home and staff was 2,950. And then the other category was residents and staff, which was 750 and 800. So I added all that up. So is that 10,400? So that's the total amount of doses to date that Frederick County has received so far during the pandemic. Can someone confirm that?
I'm back on. This is Barbara. Can you hear me?
Yes.
Okay, good. The health department, we do not know what CVS and Walgreens have received.
Okay. But the numbers you gave, so you're aware of 10,400 doses?
No.
Between the health department, 5,800, the hospitals received about 4,400, something like that. So it's just over 10,000 between the hospital and the health department, and that's over a 4-week period.
And
okay.
And the Frederick Community Action Agency doses.
I don't know.
So just over yeah.
So when you hear that some of the vaccines haven't been used, they could be CVS and we have no idea.
Okay. No, that's good to know. And then the last, just briefly, you said that you don't know who's your point of contact, Dr. Brookmeyer, for when you get notifications of doses coming in. So, and I know you don't know what's going on with the CVS or Walgreens, but when it comes to the purview of the health department, who sends you an email or contacts you, and when is that? How does that work?
So I receive an email the last 3 Saturdays. I have received an email, and I will see who sends that. It technically comes from Brian Morose. He is Acting Assistant Secretary
Of Health.
For MDH, yes.
MDH. And then once you get that email, then you update the county system, and then folks can, like, for example, we're moving into 1B. Once you get an allocation, you'll update the system if people have opted in, and then they can start scheduling. Is that kind of the deal?
No, because I don't know when I'll receive it. So I received vaccine Tuesday of this week, but the prior 2 weeks I received it on Mondays.
And then the first she received it on a Wednesday.
Right.
So
right.
you wait
a
till it's in
Wednesday before
hand.
that. So I've received it on a Wednesday, a Monday, and a Tuesday. So fortunately, we the way we had scheduled our appointments, because I knew that we didn't have a reliable delivery date schedule cadence yet, we intentionally did not schedule every single dose to be utilized by Saturday of each week, because we wanted to make sure rolling into Monday and Tuesday that we had vaccine available so we could schedule in advance.
So you wait till they're in hand?
Yes. So
Okay.
we are deviating this upcoming week with the interest of vaccine getting out and our having the 300 appointments available last night for today. We fully scheduled those, but that with those appointments, plus what we already had scheduled, which was full for Saturday, we don't have vaccine left. Now, there may be no-shows from today. There were some no-shows from yesterday. There'll be some no-shows from today, but we are opening up more appointments. It's not that many. It wouldn't be enough to hold a whole clinic on Tuesday. So we are making those remaining doses available through appointments for today and tomorrow.
So
All right. And then as a population, we're in line with the other counties for allocation?
I'm not sure.
Okay, all right, thank you.
Delegate Cox, you had your hand up at one point and then it went down. Do you have a question?
Thank you, Madam Chair. No, the question was answered in the ongoing discussion. Thanks.
Thank you very much. Delegate Krim, I believe you have another question.
Thank you, Madam Chair. I have several questions. Regarding pre-registration, you said during this presentation that pre-registration would not be working for the next 2 weeks. Am I correct? I'm just trying to get some kind of sense of where we are and what I'm to tell my constituents who are calling me about this.
So two separate things. The Maryland Department of Health's PrepMod software system was to have the functionality of pre-registration. I don't have a go live date for their pre-registration system. So instead, Frederick County Government IT is developing, as they did back in H1N1, the pre-registration system. So we will have a pre-registration system. If you want to find out from the state the status of that on their end, that would be great.
Okay, all right. So, so how does somebody pre-register now for next week?
So the pre-registration system details will be providing that at a future time. We didn't know what the governor was going to say, so we need to make some additional adjustments based on, you know, oh, the governor was speaking, and this is what he's doing, and this is the time period.
Okay, so somebody listening today who is going to be in the 1B category, who according to the governor can get their vaccine on next week sometime. So what do you advise them to do? Because I have people texting me right now saying that they've been trying to get online at the local health department and cannot.
Yeah, we don't have appointments available. So you mean they can't get online, where they can't get to our website? Or
they can't do anything to register.
You need to tell them that all the vaccine we have has already been allocated, and a link will be posted when we have more vaccine. Okay,
where is that posting? Tell me where the posting is.
So I will send to Joy the link. So Frederick County Health Department, we have a vaccine page and it has that information. I could pull it up on my screen share if you want, or let me see if I can put it in a chat. I will pull up the link and put it in a chat for you.
But it will be up temporarily to make a number of appointments that are available, but based on the vaccine dosage we have. And as soon as that vaccine dosage is used and scheduled, it will disappear. So we are set up to have 20,000 people coming in and asking for appointments for 1,000 doses. That is what we've been set up with. Okay.
So when you pre-register, then what is the next step?
So we will provide the additional information regarding the pre-registration process, and we'll have it all spelled out on the website for what pre-registration means and what it doesn't mean. Because for us, pre-registration is different from actually scheduling an appointment.
Exactly.
So,
So then after you pre-register, then you as a person that wants the vaccine, what happens next?
So then when there's vaccine available, for us to be able to have appointments available, we will be going through the priority lists, and the individuals who have indicated on that they have whatever criteria that would put them in one of those categories will be randomly, we'll be extracting the people, we'll be extracting a report of individuals who meet that criteria. Then if that number is greater than what we have appointments available for, then we will randomize and send to those individuals in the way that they asked to be contacted. We will communicate with them and say, okay, we have appointments available. Would you like to schedule? And this is how you schedule your appointment.
Okay, so you just said priority, and so do you look at who has pre-registered and then you make sure they're in your priority list? Is that what you're saying?
Yeah, so when people pre-register, because I expect once we pre-register, people who are 20 years old, do not work in an occupational category that is in 1 or 2, we'll have everybody registering. And again, to try to honor our societal concept of priority groups, because that's sort of the societal agreement that there are priority groups and that it should be honored. We are going to be extracting the individuals who have at least self-reported what personal criteria they might satisfy.
Okay, so it's important for people to pre-register so then they can go into this priority system that you're going to have.
Yes.
And that is all up to local government. Is not dictated by state, correct? That's your priority list.
That's us trying to assist the process, because the pre-registration function in the state system does not work. So you're trying to do this locally. Okay,
yes,
I get that.
And
I just want to be sure to tell people what the process is. And if I'm not clear, I'm pretty sure there are other people out there who are unclear, but I'm clear now.
Okay.
So
Let me just say, based on what the governor had previously said prior to yesterday, we did not think we were going to 1B till the last week of January or the 1st of February. So that is what we were planning around. Okay. And so we are trying to fill these gaps. I do think one of the things, Dr. Brookmeyer, you may want to clarify is where folks should go to the county health department site, or should they go to the state Vax info site? I think that has to be clarified.
Okay.
Okay, yeah, so the state site is going to send people to the local website.
Okay, good. I do have something to say to the county executive. You talked about your overtime, and you've been giving comp time, and you say that needs to be.
No, the health department employees are state employees, so I'm not doing anything with them. The state has only provided the health department employees with comp time. So I am paying my employees overtime, and I'm paying my employees hazard pay, but the state has not done that for the health department. So the health department employees are just getting comp time. Well, they get comp time for
that's my question. Okay. Now, I understand that. That is a state employee question.
Yeah.
So I'm saying perhaps we can extend the use of comp time for these employees for use as a result of this emergency situation. So you said that it's a use or lose within 12 months. I'm saying
we could extend that.
If we're very constrained on our revenue sources for this year, as we all know we are, maybe we can extend that time for them to use it so they can still get comp time, but we wouldn't have to provide extra funds. I'm just trying to get some different options out there that we can use.
Yeah, so if I can pipe in, I appreciate that, the interest in being able to both recognize the extraordinary contribution. We have been at this now 50 weeks. So for the health department, our incident command on this COVID thing has been 50 weeks. So for many of us, we didn't even use our personal leave, the 6 days that you lose, let alone any of our annual leave. And you know, the comp time, people aren't even putting on their timesheets the hours that they're working because there's no point. I understand that DBM recently has considered allowing an extension of the comp time earning, or excuse me, the expiration date, extending the expiration date, which is helpful. However, for the people who are in that situation, the majority, they have so much comp time, they're, we can't allow them to ever use all the comp time. And it's actually more problematic to have people using all that comp time. Regarding the finance concerns, local health department employees, our salaries are not paid for out of the general fund. So any exception for earning overtime that would be granted to the local health departments, it needs to come out of the budget I already have. So it's not going to cost the state any extra because it's coming out of the budget I already have and what they're going to be paid out of. And the health officers across the county, across the state, are all supportive of using our budgets to compensate our staff who right now are not overtime eligible. We would like them to be able to earn overtime.
Okay.
We need them to keep working. We're at this. We are tired. We're 50 weeks into this. Work nights, weekends. And I know a lot of people do that in a lot of businesses when we all, but it would go a long way to be able to say to our staff, yes, we appreciate what you're doing, and we recognize that you're doing this. And because right now we're all working, when I'm working on the weekends and when I'm working beyond 40 hours, it's basically I'm working and not being compensated, but that's me, that's the job that I took. But all my staff, I'm now asking them to do the same when they're earning the comp time that they're not ever going to use. So they actually, either you look at it that they're working for free or they're earning an even lower hourly wage.
Okay, okay, let me just say this. I have more questions, Madam Chair, but I'm going to get off now and I'm going to allow you to move on. Thank you.
Yeah, thank you very much. I do think we're going to have to move on. I do know this is an extremely important topic, the most important topic we have to deal with, but in the interest of time, and we have 2 senators that need to get to session, we are going to move on. We will work closely with Dr. Brookmeyer and County Executive Gardner to try to get you all weekly updates to the extent we can find a process to communicate to the delegation in a concise and efficient way. We want to do everything we can to help you so that you're not spending all your time making presentations and answering questions. You're out there trying to get vaccinations and get them into the arms.
Delegate Young, I did. Oh, you're breaking up. Maybe it's me.
You're muted, Karen.
Well, that's a good reason why you all can't hear me. I'll try to do a synopsis of that. I said it would be a really, I think we need to move on at this point in time because we have 2 other topics. We have 2 senators that need to get to their session. I want to try to coordinate on a weekly basis with Dr. Brookmeyer and our county executive to get you all updates and answers on your most frequently asked questions. We want to use the time, particularly of Dr. Brookmeyer, efficiently. efficiently so that she's not spending all of her time answering questions, making presentations. We want her out there getting vaccinations and getting them in the of constituents. We appreciate all of your hard work. We know these past 50 weeks have been an inordinate challenge, and we appreciate your good work. With that, I mentioned as we were chatting before this meeting started, we're going to move straight into the Board of Ed, Frederick County Public Schools. Clearly, where we are in testing and vaccine distribution affects the school's plans. We know that even had an opportunity to update your thinking given the announcement late yesterday afternoon. But if you could, would you please give us an update on your plans as of where they are today and what is the process that affects your thinking? And I'll leave it up to you all as to who's going to go first.
Thank you very much, Delegate Young. I'm going to kick things off, and then we'll go to Dr. Albin, and then Vice President Yoho will finish it up for us. Thank you for having us on your agenda this morning. We appreciate the opportunity to come and speak to you, and hope you all had a first good day of session, and keep having a great session. So shortly after we met in November for our joint meeting, we passed a motion to approve the hybrid plan on November 11th in 2020. And in that motion, we decided to move forward with the hybrid plan at the end of the semester, and that date was January 28th, 2021. We gave Dr. Albin the ability to collaborate with Dr. Brookmeyer, which they have done very often, to decide when we would move into the hybrid plan. As far as that plan was established, we were on a good trajectory to move into hybrid at the end of the semester on January 28th. But when the numbers hit 10%, Dr. Brookmeyer and Dr. Albin talked and decided to have a pause for us to move into hybrid. That was not part of the plan. But when we had at least three consistent days of 10% or higher, that's when the thought process changed. I know we had some people concerned that it wasn't much notice, but the consecutive days of 10% or higher is really what caused the thought process to change. So at that point, Dr. Albin was thinking that we had to delay our opening and move the dates to Wednesday, January 27th for a return, Tuesday, February 16th with a return from teachers, with school starting on February 3rd. And we also decided, Dr. Albin's announcement, that if that didn't work out and the metrics did not improve, then there would be a switch to move to teachers returning on February 10th and our hybrid plan starting on March 1st. So at this time, we are planning still to move to our hybrid model. As soon as the metrics start to improve, we want to see the numbers start to go down. They are under 10%, which is good, but the cases per 100,000 have creep back up above 70. So, you know, it's a double-edged sword that we're facing when we look at the health department metrics that were put out as far as guidance early on, which was 5% positivity rate and 15 cases per 100,000, which we've far surpassed. So, you know, our plan is still to move to hybrid. We don't want to delay anymore, but with our community numbers the way they are, the collaboration between Dr. Brookmeyer and Dr. Albin caused us to pause for now. We did see a spike in our cases in our schools with our staff and some students in December, which also was a concern and added to us delaying our move to hybrid. So, there's a number of factors that have gone into our decision. It's not just the numbers. And we have implemented a dashboard, which Vice President Yoho will talk about later on our website. And I know that's been a topic that we've all wanted to implement. So I'm glad we have that up. And, our plan right now is to still move forward with hybrid as soon as our numbers say so. We know there's challenges out there with our students and our families, and we certainly understand and appreciate the challenges that they're going through and would love to get them back into school as soon as possible. I know that you had some questions about our attendance and our enrollment, and at this moment, I will turn it over to Dr. Albin to talk about those numbers.
Thank you, Board President Mason, and good morning, State Delegation. It's a pleasure to be here with you today. As Mr. Mason indicated, I too get a lot of email and a lot of questions about when are you going to move, when are you going to come back? And I feel very fortunate in that both our Board of Education as well as our Frederick County Health Department have never said it has to be when you get to this number. There are some of my colleagues around the state where they have been told you cannot do anything until you're down to a 5% positivity rate. And that really has hindered their ability to even bring in small groups. We had small group instruction going on in our district from September up until winter break. And at that point, we were bringing over 3,000 students into our buildings for small group instruction. Our Career Tech Center was coming in, and we also had students coming in who needed access to the internet. It was monitoring those data and looking at that full picture. The recommendations from the state, but also what does the CDC say about the risk of spread within your school? Because even though there isn't any data that strongly says if you have, that the schools are contributing to community spread, when you have a lot of community spread going on, your staff and your students are bringing that into the buildings. And so what's happening? Is it being transmitted? Now we have mitigating strategies in place that have kept our schools very safe, and they continue to be safe. We did see some spread. We had a couple of outbreaks, and that's where we then have to go in and take a look at reminding people about those mitigating strategies. But also, again, what happens in the community is going to happen in the schools. Right now, Carroll County has opened in hybrid, and I can tell you that one of the biggest challenges they're facing is having enough staff to do it. They have had weeks where they have had 180 staff members on quarantine. They are constantly using their central office staff to fill in and substitute because teachers are quarantined. So that's also an implementation piece that we have to be mindful of when you have a lot of spread going on in the community. We specifically chose the word suspend because we didn't want people to think we were giving up. We are looking at the data trending down. We knew we were going to have a post-holiday surge. We want to get past that. We are looking at when can we start to bring the small groups back. And if our data continues to trend down, I think we'll be able to stay on track with bringing our teachers back on January 27th and having our students begin hybrid in the middle of February. So again, and we are trying to provide notice to folks. That's why we gave 2 optional dates, and we will update weekly to let people know where we are and what we're thinking. In terms of attendance, I interpreted that to be enrollment, because you're going to hear a lot this session about hold harmless and what happened to enrollment. And so I just want to share with you that between the 1920 school year and the 2021 school year, we saw some unusual things happen with our enrollment. We had projected for September of 2020 to have over 45,000 students in our buildings. When the pandemic hit and the announcement was made in the summer that we were going to be doing instruction virtually, we saw a significant increase in the number of families who said that I want to homeschool. That gives them the flexibility of guiding instruction on their own time with their child while schools are in a virtual environment. Many of those families, as they were telling us they were going to enroll in homeschooling, said, and when you come back, we can still re-enroll, correct? So we know these are temporary shifts. We also had many families who used what the law allows to defer kindergarten enrollment. So they opted to say, my child will wait and enroll in kindergarten in the 21-22 school year. So from a projection of 45,000 for 2020, we ended up with an actual enrollment of 43,288. So we have that number that we then are looking at as we begin to build projections for this year. You are very aware that based on the state funding formulas and how that works, we are always a year behind in the funding we get with the enrollment we are receiving. So the funding we had for this year, the 2021 school year, was based on how many students were enrolled in September of 2019. So what you've heard from districts across the state, because Frederick County isn't alone in this, seeing a lot of decline in enrollment, we would be looking at funding based on an enrollment that we know is low, because we know 1,200 students asked to be homeschooled this year. Typically, only 200 are homeschooled. So when you think about funding that we get from the state and the county being over $14,000 per student, to be basing that on 1,000 less students than we know are going to show up for school as soon as we come back to face, that's a significant loss in funding that's going to impact us tremendously. So as we were putting together our projections for next year, because that's how we have to build our budget, we have to have enough staff there to handle the actual enrollment. So even though you're funding us based on the year before, we've got a staff for the year ahead. Our projections took a look at our typical cohort survival method, but we also looked at homeschooled students. We can pretty much figure that those 1,000 extra students are going to come back next year. So we put them into the regular grade cohort. We looked at increasing our kindergarten cohort because we know about those deferrals. So our projections for the 2021 school year is that we will have approximately 45,642 students. That is significantly different than the actual enrollment that we had in September 2020. And that is why all of this conversation about hold harmless for enrollment is so important to us, because even if you hold us harmless, you're holding us harmless on a number that was lower than what we really would have had this year had the pandemic not influenced so many families to make the homeschooling decision. So it's been very challenging to navigate. There are still a lot of unknowns out there, but those are some of the numbers that we are looking at. And the reason that, again, I think you're hearing from every school system across the state about the impact on us. It impacts us a little bit more than some others too, because Frederick County is still growing. Development has been going very well in the midst of the pandemic. And so we also have been working with our developers and looking at permits to roll that into our projections as well. So that's a little bit about how we are looking at attendance, enrollment numbers for the year ahead, and how we factored that into building the budget that we released last week publicly. And Karen, with that, I'll turn it over to you to talk a little bit more about the dashboard. And I will also share, since you were talking all about vaccination, we were told last Friday that school systems had to come up with a vaccination plan for our staff. And we did not know until the Thursday evening prior to that the governor was moving us up into 1B. So fortunately, we have a wonderful collaboration with Dr. Brookmeyer. She and I were immediately on the phone. We have surveyed our staff, and approximately 70% of them are interested in getting the vaccine. So we are in the process of trying to put them into groups so that we don't overwhelm, the clinic with trying to have 5,000 people sign up to register, but sending links at a time so that we can kind of fill a clinic. So we are in the process of putting together the email list for her with those links. We are going to send a communication to staff today because, again, we did not know until the governor's announcement yesterday that they were moving that time frame up. I think County Executive Gardner shared that we all thought we had a couple of weeks to get this rolled out and planned, but we will be communicating with staff today that the school system will be providing the contact information to the health department. We will assist in getting them registered for their appointments. I'm hoping that possibly we'll be able to have one of the clinics devoted just to FCPS staff. However, again, Dr. Brookmeyer has a lot of different people that she has to serve, and I don't know if that is possible. So she and I have a call scheduled actually right now at 11 o'clock to talk through some of the fallout from the announcement yesterday. It's very good news, but again, logistically, we still have a few things to navigate. So as soon as I'm finished here, I will be talking to Dr. Brookmeyer, and we'll get a communication out to all of our staff who may be emailing you as well for help, that we are on it. We will have that information to them as soon as there's availability of appointments with the vaccine doses. So sorry, Karen, I just wanted to add that in, and I will turn it over to you.
Karen, could I interrupt for a minute before you start? Senator Huff had his hand up before and I didn't see it. And I know he has 2 commitments in the next hour. So I want to give him an opportunity to ask his question or make his statement before we move on.
I don't have a question. I just, I've got about 10 more minutes till I got to go get a COVID test. Sarah Young's the same way. We got to get them a half hour before we hit the floor at least. So I know I've got to leave here at 11:10. So if there's anything we need to vote on, I would just ask that we bring that up, or you can vote my abstention.
Okay, let me suggest a process here, and I'm sorry to everybody for disrupting the flow here, but Tuesday is the cutoff date for getting bills drafted. And we've got about 6 alcohol bills that we need to discuss or vote on. Now, I had made a statement at our first meeting that we wouldn't vote on anything unless we gave public notice a week in advance. So that's why I'm reluctant to take a vote today. But what I think we should do is get a feel for, of these 6 alcohol bills, what ones are you interested in? Would you like to move to drafting? Would you like to hear more about? Now, that doesn't obligate you to vote for it a week from today, but I need to get a sense of what ones, you have more interested in. We're not going to do that now. I'm going to ask Senator Huff and Senator Young if you could text or email me your preferences. And then after we finish the Board of Ed presentation, we'll come back to that. As we agreed in our very first meeting, unless 5 of us are in agreement, we will not move any legislation forward.
Can I make a comment here, Delegate Chairman?
Yeah.
Could you just have them all drafted, just put them in, just to meet the deadline, and then we can make,
Okay.
I mean, that's a way to do it.
Okay. I could do it that way. I was just trying to be efficient with time and resources. But we'll come back to that later. And if we don't come to consensus today, that's what we'll do. Everybody okay with that? Okay, let's go back to Karen Yoho now.
Thank you so much. I completely understand. You have to take care of business and everybody's on a schedule. This is what I had to do today, so it's not a problem. Since Joyce Schaefer seems to be the presentation controller and I'm getting signals or messages of intermittent internet, I'm going to ask her if she could pull up the dashboard because I think we were sent the link, but I think for anybody watching it home, it might be nice if we look at it as I'm talking about it.
Okay, I will pull that up. Thanks.
Thank you so much, Joy. So while we're waiting for that to happen, we have been, as Board of Ed members, looking forward to having a dashboard as a way to help be transparent with the community members. And that is now in existence. It's on. You can link from the FCPS homepage off to the right. And so it's right there. And then as you see, I'm glad you brought that one up. That's the one I have on my other computer. There are different tabs at the top. So metrics summary, FCPS metrics, and so on. And what is showing here right now are the FCPS metrics, which I think is what a lot of people would come to this site for. The schools are all listed in alphabetical order with a menu, and can drag down on that, and a map below to show locations. So right now, our numbers are looking fairly good in the schools because we don't have people right now there. So this is what was occurring before. So I can take questions on the dashboard and anything else, or President Mason or Dr. Alban can jump in. Delegate Pippi, do you have a question?
I see that both Delegate Prim and Delegate Pippi had questions.
Sorry, it was a lingering hand. It's off now.
Okay. Delegate Krim, do you have a question?
Yes, I do. And I'm not sure who is responsible for answering this. This was left over from Dr. Alban's presentation. So how many employees, teachers, and staff do you have that would be eligible for the vaccine, Dr. Alban?
Have close to 8,000 employees. And again, typically when you look at our numbers, it'll say 6,280 full-time equivalents. So we do have some people who are part-time, and we typically present our staffing numbers in full-time. So it's approximately 8,000 people who are eligible. I will be getting the final number today from our survey results, but we had over 5,000 staff members who indicated they very much wanted to participate in the vaccination.
So is that going to be a criteria for them to come back into the classroom or come back to the school to have had the vaccine?
No, that is a personal decision. And my understanding is because these vaccines were authorized through an emergency process, it is not something that you can mandate people must do.
Okay, so how is that going to affect your decision about reopening schools? Will that affect it at all? Response.
Well, obviously, it provides us with another mitigating strategy. You've probably heard the description of slices of Swiss cheese. Each strategy that you use adds another layer of protection. So this adds another layer of protection for individuals. As Dr. Brookmeyer indicated, students, children are not eligible for this vaccine.
Right.
And
yes.
So again, we have done very well with our social distancing, facial coverings, frequent hand washing. We have increased the airflow, ventilation in our buildings to align with all of the recommendations of the CDC to have our buildings operating safely. When you look at our dashboard, you can see, as I said, we had 3,000 students coming into our buildings up through the end of December. The historical data is also there, and you will see that we had few cases We did have a few outbreaks, but remember, an outbreak is only 2 associated cases. And so those mitigating strategies have worked well. We feel it is safe for students and staff to come into our building. Our concern and our reason for hitting pause was because we saw that surge in community spread. And if there are more cases in the community, there are going to be more cases in our schools. So we will be looking at that primarily in making our decision. We will not be looking at how many people have been vaccinated, and again, because it's really a personal choice, and we are encouraging our staff to do it. I am very, very pleased that we had as much of a positive response to the vaccine as we did, because I know some jurisdictions have not seen a lot of their staff willing to get the vaccine, but it will definitely be an additional mitigating strategy for us.
So I've heard in the past few months here that there was criticism of the State Board of Education about providing guidance to the locals. Do you feel you have enough guidance from the State Board of Education on reopening plans?
Well, I think that the guidance we received back in the summer when the goal was 5%, we have all asked if that could be reconsidered, given that we have a lot more research about the virus now. We have a lot more data that has come out about how things work in schools. And we were actually just told in our meeting this morning that the Maryland Department of Health and the Maryland State Department of Education are looking at coming out with some updated guidance around decision-making in the schools. So that will be incredibly helpful to us, because right now we are all at that pivot point for what are you going to do moving into second semester.
Okay, and I just wanted to make a comment on your issue about funding. That is a matter that is on the radar. I've had conversations within also with the LS staff on that issue. So it is something that will be considered and could have been addressed in the governor's budget. We won't see that for another week or so. I wanted to tell you that.
Thank you. We appreciate your support.
Thank you. I'd like to ask a question. Many of our children are suffering from isolation and depression, and others just are not that amenable, comfortable learning, can't sit still for 5 hours, and they've just checked out. So what kind of resources are available to those students that are feeling inordinate stress because of the isolation, or those that just have not been able to cope with virtual learning and are now falling weeks, if not months behind, and are perhaps at risk of being left back or failing subjects?
Well, Delegate Lewis Young, you just gave the reasons why we very, very much want to bring our students back to school. We recognize that, and we want to bring them in. Many of those students were students that we prioritized in our small groups. And so we did have some of those children coming in for small group instruction where we could. We have also, every one of our schools has something called a student support team. And this was a team that we stood up all the way back in the spring when we were in the continuity of learning phase. And so we still have our counselors who can reach out to families and work with them, our administrators, our teachers, the additional staff in the building who, again, back in the spring, maybe were not required to provide lessons, but could also work to support, make phone calls, connect. We did purchase a special software program that allows us to do telehealth, confidential counseling to provide mental health services to our students, and our PPWs and our social workers and our school psychologists continue to work together to try to serve the families and provide them with supports and direct them to resources. We are very excited about the announcement of this second ESSER funding. that we will be getting, and we have already started to talk about the great thing about that funding is that it will extend into 2023. And so I think you will see the plan from Frederick County Public Schools will be on working with our students to address the social emotional challenges that they have faced, but also to look at some of the academic support that we need. And that funding will allow us to go expand through 2 summer sessions. And that will be an area where we are going to look at bringing more students than we traditionally have for summer school in to give them additional reinforcement and support. So that funding is coming at an excellent time as we are just gearing up with some of those plans.
Thank you very much. May I just remind everyone, if you're not speaking, please mute yourself. There was a lot of background noise while we were receiving the last answer, and it was hard to listen to. Thank you. Karen, did you want to say something else?
Thank you so much. Yes, there is no one anywhere that I know that wants to get students back in more than Dr. Alban or any member of the board, but nobody more than Dr. Alban. If I can just say, we probably sent her home in tears of frustration because that is her driving goal. But I do want to put it in context. You know, I think sometimes we forget, I taught for 25 years, and we sort of look back and say, oh, those were the golden years where we were all in person. Every year I can give you names of students that did not do well while we were in school face to face. And we've heard from a number of parents, and this is something our board wants to look at with Dr. Alban going forward. We've gotten emails from parents saying, my child's doing so much better than before because they're not being bullied, because there's no peer pressure. And they can sort of self-pace with online. So go figure, where it's not for most middle school kids to not be with social groups, we do have students actually doing better whose parents are going to opt for virtual and want to see it go forward. But we know that many of our students are suffering. We hear from parents all the time. And frankly, I saw it in my last 5 years of teaching, and I've been retired almost 3 years now. Students are just feeling things more. I think a lot of it is social media, especially for our young women, and the pressures that come with that. So we've been looking at it before COVID. We have our PATH program, but we know it's something we have to address. Thank you.
Thank you very much.
Can I add to that, Delegate Young?
Have a delicate balancing act. Sorry, Jay.
That's okay. I know, seeing my 2 sons interact with their teachers and their classmates, I know that the teachers are going beyond what they might normally do to connect with their students, and having small groups so that the students can get to know each other and work together has helped my 2 sons. So I think there are extra steps besides the resources that are online or the conversations that you can have with a therapist. The 2 teachers that I get to watch every day, doing exercises with the kids and playing music as they get into class. They're probably do that in school normally, but I know that it's kind of fun sometimes watching my son do jumping jacks in the morning at 9 a.m. to get ready for class. So there are some extra things that the teachers are doing to make sure that the kids' connections and mental health is doing well. So I appreciate the stuff and the extra resources that our teachers are providing for our students.
Thank you very much. Want to give the delegation one last opportunity to ask any questions before we move on to our final topic. I don't see any hands. I'm gonna check with Ben because he's able to see better than I can. No messages from Ben that I'm not missing anything. So I want to thank Dr. Alban and the Board of Ed for updating us. As I mentioned earlier, this is one of the most frequent questions that we receive. There is a lot of confusion. And I know it's difficult for you all to address it all when you're getting information as recently as the evening before that could potentially affect your decisions. But we will keep in touch so that we can keep the delegation updated on an ongoing basis. Thank you. So,
Thank you.
let's move on to the alcohol bills, and I want to ask the delegation about your, if you're comfortable with my expectations for today. I don't think we need to go into a detailed explanation and analysis of all of the 6 alcohol bills. I think we've heard them before. We have written communications on them. While I'm uncomfortable taking a vote today because of my commitment to give the public a week's notice on anything the delegation is going to vote for, we do need a sense of what we want to have drafted. Now, we can draft them all. I just was trying to be respectful of both my staff's time and legislative services. If there are a couple of bills that clearly we don't have an appetite for. Also, I have asked members of the liquor board if they would be present today in the event that you still have lingering questions that you would like to ask them before you can take a position on whether you want to go to the next step. So, given this balancing act, if you all want to move a bill forward to drafting, and, you know, there are a majority of us that feel that way, that doesn't obligate you to vote for it next Friday. It just means that you think there seems to be enough good in the bill that it's worth going to the next level. Are you all okay with that process? I don't see anyone shaking their heads no. So let's do this. The correct light wine class B, that was item A. I have not in our discussions heard any major objections about this. So this is a bill I think we can move to drafting. Anyone have any objections about that or any questions for the liquor board? No, I don't see any hands. I don't see anyone shaking their heads no. I do see a message that Senator Young has his hand up. Is that an old message, or do you have a comment or question on?
I have a comment.
Okay.
You had previously said text you, and which I already did. I would just suggest if anybody has any objections to any of the bills to text you. And if you see it isn't going to pass, then don't make legislative services draft a bill that isn't going anywhere.
Yeah, that's my goal.
If everybody's okay with most of them, then have them draft it. But
okay. Let's do that. That's efficient. And I think this year we've got to be as efficient as we possibly can be. So if you've got an objection about a bill, text me. And if I see that 3 or 4 of you, well, 4 of you have an objection, we're not going to move the bill to drafting. But while we have the liquor board here, if you've got any questions that would influence your opinion on any of the bills, now's the time to bring it up.
Well, Madam Chair, I have a question. I don't know if I'm supposed
Thank you.
to chime in.
Sure. Yes, Delegate Pepe.
So something was brought up to me. I don't know if the liquor board wants to discuss it. If they don't, dealing with a vape shop. I don't know if that was something that was going to discuss this year. If not, then we don't need to bring it up or talk about it. But that has to be discussed. Then it's probably appropriate to do it now.
So Madam Chair, I would like to, there is an issue that we do have where two state laws are in conflict with each other that does affect a licensee in Frederick County that has been issued, but because it's a recent transfer, we do need to bring it to the delegation's attention. I've asked Dawn, who's our acting proxy, to draft something to you to get to your offices today so you can understand fully the dynamic it is between the tobacco regulations and the alcohol regulations. We require a 40% food service with 60% alcohol ratio, whereas tobacco is 80 and they can have no more than 20% food. The board is very limited. We cannot waive state requirements. So it is an active situation that we wanted to bring to your attention with the deadline being Tuesday if it requires state General Assembly action.
What's the question?
The two are in conflict with each other, and we have a licensee that can't either meet our rules or they can't meet the tobacco rules with the health department. So the two state agencies are in conflict with each other. So they cannot serve alcohol under their liquor license because if they have to choose whether they want the liquor license or the hookah license. They're in conflict with one of the two state agencies.
So they're doing both?
Well, if they're doing ours, they're in conflict with the tobacco. And so the health department's brought it to our attention.
Maybe I'm being dense. I don't understand what they're doing. That's the problem.
Oh, so they're serving more than 20% food, which is in violation of their tobacco, and they're not quite making the 40% during COVID. Now, the previous owners were making the 40% of the food, which then puts them in direct violation of the health department on tobacco.
Yeah, a restaurant can't have smoking. Isn't that correct?
That would be part, Dawn, if you could share, because she's been part of the task force meetings with the city and law enforcement.
That is correct. To have a food service license, the Clean Air Act eliminates that ability to be able to smoke indoors. So therefore, there's the conflict of the license being issued, and it had been issued years prior. So we are working with legal services, state's attorney's office, to try to figure this out and give everyone an amicable solution. But both agencies right now we're at a crossroads here, and we just need to make some decisions.
To me, it's pretty clear. We passed a law that a restaurant you can't smoke in. So I don't know how they can have an alcohol license and serve food and smoke. I mean, I think that answers itself.
Understood. And unfortunately, there's been a 15-year prior history of issuance of a license for the food side of this. So this is why we wanted to at least bring it to the board's attention.
Okay. Thank you.
Question, Madam Chair.
Thank you, Delegate Pepe.
So right now, Class Bs have a food requirement, which we adjusted a couple of years ago to 40% to help out our small business community. In order for this business to meet the health department's requirement, would they have to have their food ratio drop to like 19%?
Below 20% or below. They cannot sell any more than 20% food elements if you are doing hookah.
So hypothetically, if the delegation put in a local bill to make a vape shop food requirement at 19%, would that comply with everyone's regulations?
Theoretically, yes.
Is there a way to get a confirmation on that from like the county attorney?
And by the way, we have an attorney assigned to this group. I believe, then help me with who that is. My guess is
His name is Benjamin Voigt.
Uh-huh.
Hi, this is Ben.
And is he with us today?
This is Ben. Yeah.
Oh, okay. I'm getting confused between the two Bens. Is that something that you can help us with?
So that area is usually assigned because it's pretty technical, and it's assigned to a drafter and a team of drafters that have a specialty in that article. Yeah, so that's something that's, because of how unique it is, it's kind of an exception for a lot of the drafting. But you'll definitely, if you submit the request to have it drafted, you will get a team, as you always do, for reviewers that you can ask these questions about and how to accomplish exactly what's your intent.
Yeah, and I just want to say, not to the merits of whether they should or they shouldn't, but just want to know what options are actually available at this stage. And then the delegation can talk about whether there shouldn't be or should be something made to that extent. But it'd be good to know exactly specifically what's allowed, what's not, and what would have to happen for us to decide. So.
Okay. It sounds to me like, first of all, the delegation needs to get a written summary of what it is you're asking for. And we need to decide if it's something that we want to move forward. Okay?
Yes, Madam Chair, we will have that to you this afternoon.
Thank you. And will you get it out to everyone in the delegation, or do you want to send it to me and we'll send it out?
However you would like to have it. We can do it either way.
I would think that if you do it directly to the entire delegation, we'll probably save a few minutes.
Will do.
Thank you. Anybody else have questions on this, either this new initiative or any of our other 6 items? Okay. Then I'm going to go back to, do I see Delegate Kerr? Did you have your hand up?
I was just going to let you know that Delegate Krim has raised her hand.
Okay, thank you. Delegate Krim, I can't see you, but I apologize.
Oh,
please.
Sorry, I'll get my video back on. I had to step away for a minute, take a phone call. So, and if you covered this, Madam Chair, I apologize while I was on the phone. I would like to discuss the bills as a delegation before we vote on them. Is that what, were you asking us to vote?
No.
Okay.
I'm not going to vote today.
Okay.
I'm just trying to get a sense of what bills to move forward to drafting. So I've asked you all if there are bills here that you are adamantly against, that no way you're going to support it, please email me or text me. We won't submit them to drafting. We will draft all the remaining bills, and next Friday, we will both discuss them and vote on them.
Okay, I appreciate that, but sometimes there are things that come up during the delegation discussion that I myself have not thought about. And because we have in my opinion, we have 2 experts on our delegation, Senator Young and Delegate Pippy, who maybe know something that I don't. So that's why I would like there to be a delegation discussion before I let my, and that's just me. So.
My intent had been to try to end the meeting by 11 o'clock, but clearly we have some very important topics today that were urgent and timely. Senator Huff has left us, and Senator Young needs to go to session fairly soon, but we have our liquor board representatives here. So if you all want to stay on and continue this conversation. conversation.
Yeah, it wasn't my desire to prolong the meeting. I'm just saying that, before we make a final decision on any bill, I would like a delegation discussion. That's all.
Okay. As I said before, unless 5 people tell me before Tuesday, I am adamantly against this bill, I'll send them all to drafting. And we will discuss them next Friday and vote on them. Everyone okay with that? Okay. Tough balancing act between trying to have open, frank, participatory discussions and trying to be efficient and respect the time of staff and legislative services at a critical point. But we'll find a good compromise. Okay, anyone else on anything liquor? Okay, I do not see, and Ben, if I'm missing something, Ben, that is Ben, my assistant, please speak up because I know you're trying to keep an eye on people raising hands that I might not see on my screen.
Senator Young just raised his hand.
Okay.
No, I'm finished.
Okay. We have no public comment, which is surprising, but then again, with this form of communication, it might not be very amenable to encouraging public comment. So Ben, could you explain to the group how you receive public comment so that the delegation feels comfortable that we don't have barriers up against public participation and comment?
Yes, I am monitoring the YouTube chat, the YouTube live stream, and there's been no messages yet.
Okay, thanks. Because the last thing we want to do is have a methodology here that doesn't allow for public participation and comment. With that being said, our next meeting will be January the 22nd, 9:30. We will have the alcohol bills on the agenda. The United Way has asked to make a presentation to us. I think that's an important presentation because, as we all know, among our priorities this session are income insecurity, food insecurity, homelessness, unemployment, and they have a presentation that is very germane to many of those topics, which will influence many of our legislative initiatives and priorities during this session. Right now, I think we're going to keep it at those 2 things because I think we had an overly robust agenda today. But of course, especially in these times of uncertainty, if there is a high priority issue that comes through, we will try our best to accommodate it. So I want to give delegation members one last opportunity to make a comment before I ask for a motion to adjourn. Delegate Krim, is your hand up?
It is, Madam Chair. I just want to say that I hope we have continued input from the health department and from the county executive and the school board as we move through session, because we are in session now. We can affect policy and other matters and maybe vaccine distribution, whatever. That's part of our job, I believe. So we need to have ongoing updates. This is good today, but we need ongoing updates.
Yeah, I agree totally. This is the year that nice to know information just may not come before us because we've got to prioritize need to know information. But yes, I will, if I don't hear from them, I will reach out to the entities that you mentioned to make sure we get the delegation ongoing communications. Anybody else? Okay, I'm not seeing any hands. I'm not getting any texts. Do I hear or see a motion to adjourn? So moved by Senator Young. Do we have a second?
Second.
Okay, I heard it and I saw it. So second is accepted. I think it was Delegate Cox that I heard. Is that correct? Okay, for the record, because we're taking minutes for the meeting. And with that, stay safe, everybody. We are adjourned until next week at this time.